Hello, everybody. My name is Michelle Kinney. I am here with the Law Society. We're just going to give one more minute just for everyone to get into the room, and then we'll start. Okay. I don't see any more stragglers coming in right now, so people can join as they come, but we'll get started. Thank you, everyone, for joining us for today's Lunch and Learn, hosted by the Law Society of Nunavut. Today's session is Trauma-Informed Approaches for Working with Clients, and I'd like to warmly welcome our presenter, Oki Aikwibe. Oki is a registered psychotherapist with GN Mental Health and Addictions, and he has over 13 years' experience. His practice utilizes evidence-based therapies like cognitive behavioral therapies and trauma-informed approaches. And he's here today to, thankfully, share his insights with us in this workshop for lawyers and frontline service providers to help us learn how to better integrate trauma-informed approaches in our work with our own clients. So thank you very much, Oki, for being here today. Before we get started, we're going to hold all questions until the end. We are recording this session, so just so we have a clean recording, and we'll leave a little bit of room at the end for questions. So you can wait until the end and hold your hand up, or put them in the comments for us to take note of at the end. Thank you so much, Oki, and I'm just going to turn it over to you.
All right, thank you very much. I really appreciate this opportunity to share some of my experiences and with regards to trauma and trauma-informed care and how we could, relate that to our work environment. So our goal here is to recognize trauma impact on clients. So we have to be cognizant of that. Before I start, I would like us to have a little bit of a basis as to why people behave the way they do, right? Because when we talk about trauma, we're looking at the serious events in people's lives. But where does this start? So it starts in our environment. I've always want us to recognize the impact of the environment, that the environment influences our thoughts, our thinking, our cognition, and that also influences our feelings and our emotions and behavior. So when people behave the way they do or act the way they act, where does that come from? It stems from the environment. And I'll give you an example. If your work environment is toxic, each time you think of that work environment, what happens? You had certain feelings and certain emotions. If that work environment is positive, when you think of it, you feel it, your feelings and emotions will show positive outcome. You feel happy, you feel joy, you feel motivated. But if that work environment is toxic and negative, you think of it, how would you feel? You feel anxious. You feel nervous. You feel unmotivated. So when we're working with individuals who have experienced trauma, we have to look at their environment. And being in traditional indigenous lands or in small communities, we have to recognize the impact of racism, the impact of residential school, colonialism. So that environment apparently affects how individuals think and how they feel and how they behave. But sometimes working with individuals who's been traumatized because of that environmental impact, all we see is the behavior, that individual is very difficult, that individual doesn't want to comply. So before I go into showing the slides, I just wanted to show that aspect as to why people behave the way they do and why we need to be cognizant of trauma in their lives. That is the environment that influences everything in our lives. So then, therefore, what do we do? How do we work with these individuals? Having recognized all these environmental impacts. So I'm going to show the second slide here. It says, what qualifies as trauma? It says a traumatic event is a shocking, scary, or dangerous experience that can affect someone emotionally and physically. Remember, I highlighted the notion that the environment influences how we think, how we feel, and how we behave. It impacts or shows in feelings and emotion. So it says it's a shocking, scary, and dangerous experience that can affect someone emotionally. So then, therefore, what is trauma-informed care? So trauma-informed care acknowledges the need to understand someone's life experience in that environment, right? So I mentioned residential school, I mentioned colonialism, I mentioned colonialism, I mentioned racism, and so forth. So that experience in that environment influences how the person thinks, how the person feels, feelings and emotion and behavior. So it says, so we have to recognize that and acknowledge that is part of that person's life experience in that environment. So then, therefore, how do we deliver effective care? Having recognized the impact of that environment in that person's life. So in order to improve our knowledge and understanding, we have to be patient when we are engaging with those individuals. So patient engagement is critical. The next one is treatment adherence, and the other one is health outcomes for providers and staff wellness. So we also have to think about our own well-being when we are, engaging in, with individuals who have experienced shocking and scary and dangerous incidences in their lives. So what is trauma-informed care? So trauma-informed care is a service delivery approach that recognizes, one, high rates of traumatic exposures among clients and its potential impact on client circumstances. The next is responding by integrating that knowledge into policies, procedures, programs, and practices. So how do we integrate all these life experiences into policies, into procedures when we're dealing with clients? How do we create a safe environment that accommodates the need of clients presenting with some traumatic events or traumatic history in that environment? The next is, how do we integrate physical and psychological safety as a core to the fundamental goal to traumatic-informed approaches? And the next is, how do we create treatment environments that are more healing and less re-traumatizing for both client and staff? Because what happens is sometimes when we don't know or recognize the environment that the individual is coming, we ask questions that might re-traumatize that particular individual. I will give you one, I will set one example. I was working with a client that doesn't really like when somebody raises their voice because this individual has been traumatized by abuse in his environment. So how do we integrate lowering our voice when we're talking to those individuals? How do we create a treatment environment that accommodates that individual? But if we don't know this, then what we're doing when we're raising our voice or asking certain questions can re-traumatize that individual. Then the next slide talks about, again, continuous recognizing trauma and its impact. Remember, as professionals, impact on clients' ability to process one is, to process information or make decisions. So given the high rate of traumatic exposures among people entering treatment, it is recommended that we, service providers, adapt a universal precaution approach that is operating on assumptions that all clients have experienced trauma. So the universal precaution is the assumption that we have to believe that everyone that we encounter must have experienced one traumatic event or several traumatic events in their lives. One example that I will give you is my own trauma. Each time it rains or there is lightning, I become traumatized because I saw my father got stricken by lightning. So to me, each time there is lightning or rain, I have flashbacks, I have nightmares. So how do we as professionals recognize what's happening in that person's environment? So we have to use the universal precaution, which is the assumption that every person has had one traumatic event in their lives. So we have to be cognizant of that. And we have to operate under the assumption. Operating under the assumption does not, however, negate the need to assess clients individually. So we cannot use or assume that one procedure fits all. So we also have to assess individuals individually. The next is trauma exposure should be routinely assessed sensitively by suitably trained practitioners. So before conducting trauma assessment, workers should seek training and supervision in dealing with trauma responses because the impact is not the same. So when we go by the assumption that everybody has experienced some level of trauma in their lives, does not mean that it impacts each and everybody the same way. For instance, I'll use grief and loss. I could use colonialism. I could use residential school. When you talk to individuals who's been through residential school, the impact of that residential school is not the same. People experience residential schools. Some people will tell you it was great. I learned so much. Some people would tell you it impacted their lives negatively. So that's the reason why when we're doing assessments or recognizing impact of trauma, that it does affect everyone differently. It doesn't affect everybody the same way. So we have to be mindful of that. Same thing with grief and loss. When we're dealing with individuals who have gone through grief and loss, the way it impacts one person, say for example, a family of 5 that lost their father or lost somebody. you would see that some people will get over those griefs faster than the other person. So everybody in that stage of grief and loss can be at a different stage in their life. Some people must have come to acceptance, the ability to accept that this person is gone and now it's time for me to move on. But some other people may still remain at the fourth stage, which is denial or anger or shock, when the other person have come to acceptance. Some people may get stuck in bargaining. Would have, could have, should have. The other person may get stuck in depression for so long. So when we are assessing individuals in terms of level of impacts, we have to assess them individually and do not compartmentalize them as one, that everybody has experienced trauma, then therefore I'm going to be very sensitive to this individual, or I'm going to do XYZ. No, we have to be mindful that each and everyone, or the impact is different for everyone. Another thing we need to be cognizant of is incorporating some questioning into most initial assessments. Signals that is a standard process. So it says incorporating some questioning into most initial assessments. So what does that mean? So that means that when we are asking questions, questions may be different. The question you ask A may be different from question you ask B based on their responses. There are certain questions you might ask and you realize the person is more sensitive or is not even responding to that questioning, then therefore we have to withdraw and give them time and space. We also have to recognize that it's important in both understanding why people present to treatment and in determining appropriate treatment pathways. Then therefore it's individualized. So when you're dealing with client, the way you deal with client A may be different from the way you deal with client B. Client A may be difficult and client A may be a little bit easier. So each and every one of us must use their judgment and expertise in determining when it's clinically appropriate to ask more detailed questions based on a client presentation, just like what I just alluded to. Sometimes when I'm working with clients, I don't ask too many questions. I let them tell me what their experiences are, but not me assuming. So we have to be very, very careful when dealing with individuals who has experienced traumatic events, shocking events in their lives. So we cannot go by a set of questions already prepared that each and everybody that comes has to answer all those questions. Sometimes I kind of limit my questions and just let the client talk and tell me what their own experiences are. So in some situations, for example, it may be more beneficial to raise the issue of trauma some weeks after the initial assessment interviews. So when we're meeting with clients, so the very first time we don't kind of overwhelm them with a series of questions. We should give them time. And we'll talk about some of the principles of trauma-informed care. One of them is safety, providing a safe place for that individual. If people don't feel safe around you, they're not going to open up. So we, first of all, have to build that rapport and build that psychological safety for that individual to open up. Even in our own families, even within our own friends, if your friend don't feel comfortable and safe with you, they're not going to talk or say anything around you. They will be a little bit cautious as to what they say. So the same thing when we're dealing with clients, we first of all have to establish that safety for them. And we'll talk about safety and collaboration at one of the slides. So once the clients feel safer and a therapeutic relationship has been developed, then therefore you would then start seeing more results in terms of collaboration. So slide 6. So how do we respond to trauma? So this area talks about practitioner approaches and programs and procedures. So it says that a number of modules have been developed to guide organizations and individual workers in incorporating trauma-informed care into their policies, program, procedures, and practices. Common to all of these are 6 guiding principles. Like earlier on, I alluded to safety. If people don't feel safe around you, it will be difficult for you to work with those individuals. So trauma-informed care recognizes 6 principles, and one of them is safety for our clients. Ensuring that clients and staff feel physically and psychologically safe with respect to physical settings and interpersonal interactions. The next is trust and transparency. So that's why when I meet with my clients for the very first time, the first thing I try to establish is that trust. Because if clients doesn't trust you, then it will be very difficult for them to work with you. And be transparent and tell them from day one that this is how I work. That these are my expectations from you, and this is what you will be expecting from me. So the first thing I go over with them in my line of work is confidentiality, consent, treatment planning, how many sessions I'll be doing with that particular individual from day one, missed appointments, my treatment goals, and my treatment modality. So what I use primarily is called CBT, Cognitive Behavior Therapy. I tell you that this is what I use. And interventions is CBT, DBT, Dialectical Behavior Therapy. That has 4 core areas. So I highlight those 4 core areas. We talk about mindfulness. This is what I'll be helping you with. Emotional regulation, distress tolerance, interpersonal relationships, and that I also incorporate traditional teachings into modern psychotherapy. So I also use traditional indigenous teachings. So I highlight all these things. I'm very transparent from day one that this is what I'll be working with you on. And this is how many sessions I'll be going over with you. So trust, worthiness, and transparency is key. It's important when we're working with individuals who has trust issues, who in that environment has failed them severally. For instance, we're working with individuals who has experienced some traumatic events in residential school, like I alluded to, or people who has experienced racism in their lives, or people who have experienced suicide, or people who has experienced family violence. So trust and transparency is important. I always lay a lot of emphasis on that. So the other key principle is peer support, promoting mutual support to help in healing and recovery. How do you align these individuals with other people who might be able to help them? Because we're not going to be there with them 24/7. Most of the clients that I see them for 45 minutes or 50 minutes. But then what other resources are we providing for these individuals when they leave my office? Similarly to individuals in other other practitioners. So what kind of other support? And I know that sometimes, yes, I get a lot of clients that says, yeah, my lawyer asked me to come for counseling, which is great because now you are, as a matter of fact, providing them with additional support, so which is great. I see a lot of them and they tell me that my lawyer sent me here. So peer support, where they can get that support, whether from other professionals, is key principle in responding to trauma, so that they will be able to start to address all some of the underlying issues and problems that they have. So number 6, so number 7. So number 4 is collaboration and mutuality. We have to remember that we are working with individuals who feel that there is power differentials. How do we now, when client comes to me, in fact, I tell them I know nothing. I don't see myself as above any of my clients. I tell them that they are in charge. I empower them. I say to them, you're in charge here. I'm only here to guide you. You are the expert in this particular encounter. And in fact, a person-centered psychotherapy informs that the individual is their best counselors. That's person-centered approach, designed by a great psychologist, Rogers, who propounded and researched that area of person-centered therapy, that the individual is their own best therapist. So I try to level that power differential by empowering them and letting them know that I don't know more than you do, that you know more than I do. So we're here to work together. And then that comes to the number 5 about empowerment, voice, and choice, giving them choices and not saying that this is what you have to do. But I know that in legal field, yes, sometimes you have to go by the rules, and those rules sometimes can be very straightforward. But then how do we recognize and build upon that individual's experience again and strengths? The number 6 is cultural, historical, and gender issues. Acknowledging the impact of historical trauma, colonialism, racism. We actually recognize that some of these can impact individuals negatively for the rest of their lives, even their own self-esteem, over discrimination and implicit biases. So those are how things that we have to recognize in responding to trauma as practitioners. Some of the approaches that we have to adapt, or programs or policies or procedures that we have to implement and utilize in working with individuals who have experienced trauma in their lives. And the next one is 8, I'm sorry. So moving on, so a focus on building trust is essential in worker-client interactions. Many clients who have experienced trauma have occurred in the context of interpersonal relationships in that environment. It's relational. Everything that happens in our lives is as a result of an encounter. Your environment. In that environment, we're not alone. They say no man is an island. So either work environment, you're dealing with people, school environment, you're dealing with people or somebody else. In your relationship, So that environment is powerful, and it is filled with interactions with others, the interpersonal relationships. All right. And then the next one talks about additional part of the process in building a sense of trust. So we're looking at, remember we talked about those principles earlier on. So the principles of trust, principles of safety, principles of collaboration, right? So the last one there talks about for those who have experienced interpersonal trauma, in particular, healthcare providers may also be seen as authority figures. Remember, we talked about the power differential. And some interactions may intimate the interpersonal dynamics that were evident in an abusive relationship. So when somebody, for instance, who has experienced abuse in their lives in that environment, now coming to for treatment or trying to seek professional advice, either from lawyers or from other professionals, we have to be very careful because, again, that individual have gone through series of abuse in their lives and power differentials. So then, therefore, when they're meeting some of us, then we have to at least be cognizant of that and just be a little bit, show a little bit of empathy um, in that regard. So number nine. Number nine talks about, again, going back to the principle of safety. So how do we create a safe environment? Um, in my office, I think this is some of the things that I do is I make sure that I create an adequate environment when I'm doing psychotherapy, that there is adequate lighting, there is the room is comfortable. When my client comes in, the first thing I ask them is, do you need water? Do you need a cup of coffee or a cup of tea? Something to make them feel a little bit comfortable. Is the light okay? Do you want me to turn the light off? Do you want me to turn the light on? Because you don't know what these individuals are coming with. Some people who go through abuse, you don't know if this person was abused in a very dark or confined environment. Some people will come into a room and tell you this room is too small. It kind of brings back memory. Or the room is too dark, which again could bring back memory. So adequate lighting and common area are well lit, sufficient space, like I indicated earlier, for comfort and privacy. Sometimes I will bring clients into a room and it's too small, then I take them into a family room, which is very large and more comfortable. So all these things allude to creating a safe environment. Sometimes our offices can be too small, overcrowded. How do we make those individuals feel safe? Do we go to a conference room where it's much, much bigger space where the individual may feel a little bit safe and comfortable? Sometimes the individuals, making them feel safe, say for instance, a woman who's been raped or abused, may not feel comfortable with a male counselor, a male psychotherapist. How do you recognize that and say, well, I need to let my supervisor know that I cannot handle this case? Because if that individual doesn't feel safe around you or has been abused by a male, then how do we change that and make that experience a little bit comfortable for that individual? Privacy, clear pathway to building entrances and exits. How is your office setting? Are you sitting by the door and then that individual feel trapped? Sufficient staffing to monitor the behavior of others that may be perceived as intrusive? Another way to create a safe environment is what the fifth one, no groups of people loitering at the entrance and exit. This is primarily in my own practice. An absence of exposure to violent, sexual, or offensive material in common areas. So we have to be careful with what we're posting around those office areas or those environments. 6 is an absence of exposure to violent, sexual, or offensive materials. The last one there, it talks about welcoming language is used on signage. Number 10 talks about barriers to providing trauma-informed care. So whatever we do, there is always going to be barriers. There's always going to be obstacles. But then, therefore, how do we deal with those barriers? So one of them is inconsistent understanding of what it means to be trauma-informed. Remember, when I started, I talked about dealing with individuals individually. Let's say, for instance, when I'm creating a treatment plan, I don't create a treatment plan that fits all. Say, for instance, if I'm dealing with somebody who has had PTSD, post-traumatic stress, what I do is I look at the underlying cause for each and every individual, because the underlying cause for one person may be different from the other person. The impact on one person may be different from the impact on the other. So I'm not utilizing a treatment strategy, a treatment plan, one plan that fits all. No, it has to be individualized. So that's what it means, what I'm talking about when I say inconsistent understanding of what it means to be trauma-informed. So if I'm trauma-informed, I'm not going to say, well, this person is traumatized, so then therefore when I'm talking to this person, I'm going to do this. And when B comes, I said, yes, I'm still going to use the same plan. No, we have to individualize each and every person, because each and every person's experience is different, because the impact of trauma is different on each and everyone. The next is barrier is translating trauma-informed care to specific practice and service settings. So each practice can be different for each and every provider. The service setting in one area could be different from a different service setting. The next is facilitating complex system change. So how do we facilitate system change? Because that could be a barrier. But sometimes some people don't accept change very, very well, or adapt to change very well. The next is evaluating a trauma-informed approach to care. And then the last is barrier is how many facilities have systemically failed at inquiring about patient trauma. Survivors can experience stigmatization and a lack of acknowledgement. Then the next one is about trauma screening, which is the most fundamental aspect of trauma. How do we assess? When we assess, how do we differentiate? And then how do we implement an informed approach? And sometimes experts can be conflicted on when or how to screen. Like I said, the best way to screen is to be flexible and to assess each and everyone individually. Because again, trauma impacts people differently. It's not a one size fits all. I think that is where I will stop so far and maybe take some few questions, some clarifications at this time. Thank you.
Thank you, Oki. That I found that so insightful, and I particularly really appreciate the practical tips. I know for myself as a lawyer, I often struggle with how to balance what my role is and what my role isn't, like because I'm a lawyer but I'm not a counselor. I'm not trained as a counselor. And when I'm working in areas such as, particularly like family law and dealing with family violence, um, it's so important to have all these insights and tips to try to balance the role of like where do you overstep? How do you have those conversations without actually me overstepping my role and acting in a capacity like a counseling capacity, which is not what I'm trained for, and how to get those resources. So um, I find that a tricky thing in my practice, and I found that incredibly helpful. Those tips are incredibly helpful.
Yeah.
Um, does anyone have any questions or comments for Oki? So you can just speak up. I don't think I can see the chat, Santana. Is there anything in the chat?
No.
Oh, there is.
Yeah.
Okay. All right. Well then, seeing none, I just want to thank you, Oki, so much for being here and for your, I don't know, I found the presentation like so actually calming and accessible, and I really actually feel slightly more um, able to kind of think through what I could do in my own day-to-day practice to try
Yeah,
to help clients who are
absolutely.
facing trauma and integrate trauma-informed practices better. So I thank you so much for being here and sharing your calmness and your wisdom. We really appreciate it. Thank you so
Thank you
much.
very much for giving me the opportunity, and I hope that we'll have more room and more time to talk about and reflect on trauma-informed care and approaches. Thank you very much.
Thank you.
All right. Bye-bye.
Bye.